Happy Friday. I am Jillian Mason, and this is the Medicare for All podcast, the podcast for anyone and everyone who needs health care. I am so excited to be coming to you today. We are trying out a new format here on the Healthcare for right here on the Healthcare Now Medicare for All podcast. We have decided that we really want to be able to bring you more of the latest news and to be coming out on a really consistent schedule so you can anticipate to have us in your day at a certain time. And so we are really excited to come to you. And unfortunately, my regular co-host Ben Day was unable to record today. As you'll recall, he works for Friends of the Earth and he's off saving the environment. But very luckily, I was able to secure a wonderful co-host. And specifically, I've got here Misty Dawn Parker. Sorry.
Hello.
Hey, Misty. Dr. Misty Dawn Parker, I should say.
Dr. Jillian Mason.
Oh, thank you. No, I think we're not supposed to tell the audience that I'm a doctor. It's supposed to be our secret. Missy is a political science professor here in Texas at one of our fine community colleges. She's been on the show before talking a little bit about organizing with Indivisible at the beginning of Trump 2.0. Yeah, Missy, how are you feeling about Trump right now?
Well, it's the same piece of shit as always, but I like seeing him fumble, bumble, stumble, and generally be shot at. All of these things are enjoyable entertainment avenues for me.
Seems like a great moment to remind everyone that we don't condone political violence.
I'm just saying
Medicare for All podcast.
I'm not saying there've been no connections.
There are no connections whatsoever. And by the way, Misty does not represent us.
I'm really glad I've made two horribly inappropriate statements in the first 3 minutes. It must be a record.
This is fantastic. Actually, it's not even a record. I think I messed up the intro to the show a couple months ago. Anyway, again, very excited to have you here. Always excited to have another fellow Texan. Missy's a real Texan, by the way, born and bred here in Texas. She's a Molly Ivins radical, and we're very lucky to have her with us. So why don't we launch into some of the major healthcare news from the past couple of weeks? You ready for it?
I mean, as ready as any of us can be.
Yeah, trust me, you're not ready. None of us are ready. So I wanted to start out, I think one of the biggest pieces of healthcare news in the past couple of weeks has been the RFK Jr. congressional hearings. So members of the Senate called RFK Jr. to 7 different hearings over the past few weeks, asking him about everything from Health and Human Services priorities. Health and Human Services, by the way, is the department that he's supposed to be the head of. Anyway, people asked him about Medicaid, about National Institute of Health cuts, vaccines, rural health, all the MAHA crap, and some budget issues, which we all know is the sexiest stuff. Missy, just quick prediction from you. I know you haven't. I don't think you got a chance to watch the hearings.
Oh no, I purposefully didn't. But continue.
I was going to be generous and say that you've been finishing up your semester. So
well, that part is true. I have to
Missy, just given what you know about RFK Jr., I have to be careful to say Jr. by the way, because I was on a call the other day and I said something about trashing RFK, and they were like, Bobby Kennedy did nothing to you. And I was like, obviously, I'm talking about the bad one.
They're like, too soon.
R.I.P. Bob. Anyway, so we're talking about the bad one, RFK Jr.
Yep.
Based on your knowledge of him, what would you guess came out of that hearing?
Well, my instinct would be some outright lies.
Okay.
Twisting of numbers such that it sounds what their plan is sounds beneficent instead of nefarious.
Great.
And probably a lot of other indecipherable garbage. So I don't know. Tell me the truth versus my prediction.
No, that's it. No. Moving on to the next story. No, I'm just kidding. No, I mean, that's really basically what had happened. I mean, the funny thing is that he is still willing to tell the truth about his insane ideas, right?
Well, you know what? I appreciate you mentioning that because, of course, there is some things that he actually seems to truly believe. And
yes.
Fine with I mean, a lot of those things aren't true, but he tells the truth about them as he understands it in his very warped warped brain.
Okay, again, I just want to say he does not have a brain worm. I'm not a doctor. I haven't seen the scans, but I'm going to go ahead and say he does not have a brain worm. That is an excuse he made up to try to avoid paying his wife alimony. Because he said it would affect his net worth and his.
There's a reason people believe it.
Yeah, it just happens to coincide with what we know about him and what we know about brain. No, actually, I don't know enough about brain worms. Okay, so. He was answering these questions. He's very sincere about the things he believes, as we know. But he's also just like completely lying about some of the most important stuff. And we have got a few humorous back and forths in the hearings. One of the funnier moments was when Senator Maggie Hassan from New Hampshire, she's a Democrat, she questioned him about the new restrictions on COVID shots that are going to actually make it more difficult for a lot of folks to get COVID shots because they're indicated for folks who are over 65 instead of being available to all of us. So she asks him about this, and he says, this is a policy, again, that he approved. And he says, this is crazy talk. You're just making stuff up. And she replied, sometimes when you make an accusation, it's kind of a confession, Mr. Kennedy.
Ooh, that's a good one.
Sick burn from Maggie Hassan. I love that. I love that so much. I mean, these committee hearings are frequently just, complete theater, but, it's always nice to catch them, catch them out, get them to say things out loud.
Yeah. I mean, all of them look at kind of compete for those moments that they can then use to campaign fund or whatever,
or just go viral on TikTok,
which is its own, form of that very same goal. But yeah, it can be. I really like the various shows that will like take the zingers and put them all together, and so you can see the humiliation occur in real time. Those are good. And then
I like that too.
All the other stuff, just cut it out.
Yeah, it's like a super compilation of the greatest hits, and then just eliminate most of it. I
don't need to hear any of the rest of it. It's not. There's no commitment to truth telling.
Yeah, there isn't. And I feel like it's bad when the AP has to fact check you, and the AP did in fact fact check him. And so one of the things they pointed out is that he continued every time Medicaid was mentioned. People would talk about the $1 trillion in Medicaid cuts that he has gone into the federal budget. But he totally denied that.
Okay.
All right. Okay. And he said, and I quote, there are no cuts to Medicaid. We are increasing Medicaid spending by 47% over the next 10 years. Increasing spending by 47%. How is that a cut? That is only a cut in Washington, D.C.
Yeah, there's just so many things ridiculous about that. I mean, the first thing is compared to, increased by 47% compared to what?
Right, exactly. So, I mean, the increase that he's talking about is the projected increase in our changing population and our rising healthcare costs, right?
Right.
Does not mean that there was not a funding cut. There was a funding cut, to say it even more clearly. But yeah, so basically what he's taking is, as they project the budget, of course, right? They project ahead to think like, okay, so we're going to have, 1 billion more seniors who are going to be on Medicare. So that's going to cost a certain amount. And they're going to be, we know that healthcare costs go up 3 zillion% every year. So we're going to have to account for that and whatever. And so, yeah, so he's able to claim that this is actually an increase.
I mean, he doesn't really even have to try that hard. I mean, really, I feel like they should really lower their bar, because they can just say anything. They don't even have to try to connect it to any kind of even fudging of the numbers, or maybe just make it up.
I mean, or is that admirable maybe in the Trump administration to be that committed to actually coming up with a plausible rationale?
I'm fairly impressed. I mean, old Bondi and old Christy Nome, dog killer Nome, they neither of them even tried.
It's really true. It's really true. So our smartest public health official, lying about the Medicaid. Love that. Fantastic.
Yeah.
I think another story that was definitely on my radar over the past couple of weeks is that Nebraska is about to be the first state to institute Medicaid work requirements. I appreciated that. Boom, boom, boom. Yeah. So, I just, for those who are, keeping score at home, right. Medicaid work requirements don't really work. We've done a couple of episodes on this, talked about it a lot on the podcast, but, it's a generally just an added layer of bureaucracy. You got to think about it. They don't even have websites that are capable of verifying the kind of ID that it takes and the kind of documents it takes to verify people's employment and student status, et cetera, et cetera. As well as, and this is their term, not mine, medical frailty. People who are medically frail, I don't even know if that's a technical term, are going to be exempted.
Do you remember the? No, I guess maybe you might be a little bit older, but there was in kind of high school, there's like a sweet spot where being frail was like the boys would call each other frail to say like they're like they're not real man. Maybe that's a Texas thing. I think guys would just be like frail, like to say like lame or weak or whatever. So maybe maybe somebody like Big Balls or somebody wrote that.
Frailty.
They hired like a Gen Zer to.
Big Balls being the Trump administration.
Yes,
right?
Yes. Oh yeah, that guy. The Big Balls. Sorry.
Yeah, I worried people would think you were talking about RFK again.
I don't know.
Well, he's older. Nebraska's going at it. And again, Medicaid work requirements, add a tremendous bureaucracy to something that's already way too bureaucratic. And, we already know that probably like about 11 million people are going to lose their coverage overall in the country because, of course, that was part of the federal budget that passed last year, was this, notion that we should require work requirements for people to be eligible for Medicaid. So Nebraska is so jazzed about this that they are actually 8 months ahead of the mandate. Wow. Can you imagine being so fucking jazzed to cut people off their health care that you're like, no, I can't wait the 8 months. Let's do it now.
Yeah, I mean, I'm actually quite intrigued by the fact that it's Nebraska.
Okay.
I mean, like, first of all, it's the only state in our country that has a nonpartisan legislature. So you immediately go like, we there's a reason why it's designed that way, is this kind of attempt to like keep people independent thinkers and to make sure that they're connected to the people instead of like, whatever the party machine are, the partisan interests and the various funders and blah, blah, blah. So this is supposed to create a level of like disconnection from national politics in that way, and the partisan kind of back and forth. And yet they're the ones who are like, let's do it before we even have to, before we've even figured out all of the bureaucratic things that would need to be put in place for this to work. We're going for it. It just, I don't totally understand that. I'll be honest with you. That's a puzzler.
Do you think it's ever worked? Like, has Nebraska consistently been kind of independent from national politics? I know very little about Nebraska except for the Bruce Springsteen album.
Well, that's more than I know, quite honestly. But we're
doing great.
I mean, the only thing that I can even think of in recent times that would kind of indicate that it might have some independence is Trump, whenever he was pushing for, or he still is, and he's still pushing for these redistricting maps all in the red states. He was, upset because he was also upset because of the way Nebraska allocates its electoral votes. And so he was trying to get them to change that law. And they were like, no, we're good. And cool. Try to get them to redistrict. And they're like, yeah, we're good. So, I mean, that's all I know.
Yeah. Well, so there's some resistance to national trends there, but seems like not that much. So they're rolling this out, and obviously there are a lot of concerns from public health officials and doctors and advocates and sick people about what's going to happen. In Medicaid, they use the term churn to describe people who are bumped out of the system for no reason other than administrative errors, right? They sent your authorization form to the wrong address and you never got it and you never returned it, or just accidentally you have the same name as someone else. I mean, it can be that ridiculous, and you lose your health care coverage. So
same reason as you get cutting off the voter rolls, in these red states.
Precisely. Yeah, no, exactly. So they're rushing this a little bit, and people are a little bit concerned about that. And one interesting fun fact is that they're using a company that not a lot of people have heard of. It's called Deloitte. And it's a company that specifically has like $6 billion, according to Kaiser Family Foundation. That's a good Kaiser. They have about more than $6 billion in contracts with states to administer Medicaid. So they're the largest player in this field. And they are also, of course, the ones who are working on Nebraska's system. And I just want to remind folks that back in 2024, they really, really screwed some stuff up. And that in states where they're working, they have created errors that have cost millions of dollars to fix, and have taken years as well, right? So it's alarming that they're racing to do this, and immoral. And it is really troubling that they're using this private company that has fucked over people in many states by screwing up their Medicaid rolls. So good news there.
I mean, good governance, always vetting the contractors.
Yeah.
Subcontractors deeply. And
what do you call it again? Being a good steward of public money?
Oh, I've heard the term. I haven't practiced in a while, but I've heard the term.
Mm-hmm. Yeah, very good. Very good. In Texas, obviously, we have to talk a lot about whether or not people are good stewards of public money. I'm not going to even, you can guess how that conversation starts and ends. So, all right. So that's some bad news. And honestly, there's way more bad news we could go into. I mean, there's some crazy shit going on with, AI systems that are messing up pre-authorizations for insurance. And, oh, God, just everything. Measles is up again. You looking forward to getting the measles, Misty?
I mean, I think I have actually been vaccinated, but maybe it doesn't matter. I mean, I guess if you have a certain amount,
right. Is that the one you have to update or no?
Oh, yeah, it's like called the MMR, right?
Right.
I think I don't know. I don't even know. I mean, this is the problem. It's like a lot of these diseases were, what would you call, eradicated until we've decided to push so much misinformation about these things over a extended period of time. And so now we've got these rises. So I'm actually thinking about these questions in a way I kind of had taken for granted that I would never really have to.
Yeah. I get that.
So avoidable.
That's a real thing. That's a real thing. So if there is a doctor listening, please do let us know whether we're going to be okay about the measles.
Somebody please confirm I will survive the measles.
I would like to know personally about my prospects for surviving measles. So reboots are really in. And so we're rebooting a lot of these old, viruses, diseases, bacteria and stuff that haven't been around for a while. Sure. It's a trend. And you know what else is a trend though, Misty? Something that is not sad. Would you like to hear about something that is not sad?
I would.
Hey, so Medicare for All is still going strong in the primaries. We've still got primaries going on in the country. Folks may have seen our last episode. We were interviewing Abdul El Sayed, who is running for Senate in Michigan, and talked all about his positions on Medicare for All. He's been a Medicare for All stan for a long time. And he continues to make news, and make moderate Democrats nervous. So one of the former Democratic committee chairs in Michigan, Cortez Masto, said, "My concern over a primary like that in a swing state, it's the moderate over the progressive that wins." Which is funny because I don't know if there's much evidence to bear that out.
Yeah, it was just, that's what I was kind of sitting there trying to ponder, was like, is that so in a swing state, which we might have 10 of them out of 50, and that's depending on how you define the term. I don't know. I don't know if I've seen anything like that. In fact, what you tend to see, although this is less true for Democrats than for Republicans, but you tend to see that in primaries, like the more either seen as like ideologically pure, or the more like kind of the more extreme candidate, and I don't mean to use extreme as any judgment, just more to the side of the spectrum.
Sure.
they tend to do better. I think that's like a kind of a general statement in primaries, but maybe in swing states, there's a whole other pattern that I just am not aware of. I would say that person is probably just not probably a moderate herself and sees herself in everything.
Them, I'm not sure the pronouns there.
Pronoun. Yeah.
But regardless, I am guessing that person is a moderate. But regardless, that is a sentiment that we certainly hear from moderates all the time, right? You got a swing state, and so you got to aim for the middle, and that's how you win. And that, to me, I'm going to call bullshit on that. Because all over the country, we've been seeing really progressive candidates win out.
People who have vision, do a vision, tend to connect with voters over people who are just like, just consider me the centrist in the mix. It's like, that's not it's just not a real selling point unless you're positioning yourself against somebody who's just incredibly out there. And if so, maybe that's good enough. But still, I think people want a vision. Like, they want to know, like, what do you see for us? Do I align with that? And if I do, if I can see myself in your vision, then I want to join it. I want to vote for you.
Yeah. Yep. Yeah, no, I mean, I think if you're living in America in 2026 and you are apathetic about the issues,
if your spirit animal is Kirsten Sinema or Cinema, whatever.
Cinema.
Excuse me.
So if your guiding star is Kristen Sinema, then you will be. Anyway, these primaries, I think, are doing a really good job, though, of illustrating exactly what people want right now, so very exciting news coming out of Maine that sort of exemplifies this point, which is that Janet Mills dropped out of the Democratic primary for Senate there, which means that Graham Plattner is now the official candidate.
All right.
And of course, Graham Plattner is a big supporter of Medicare for All. And by the way, just a couple of weeks ago, he signed the Patients Over Profits pledge. You know about that, Misty?
I do know over the POP pledge.
It would be the POP pledge. Yes, very good. I make Misty hear about this all the time. So the Patients Over Profits pledge is a pledge that we developed with the Nurses Union and People's Action and a number of different progressive groups who are for Medicare for All. And specifically, we are targeting in this pledge, we're asking candidates not to take money from the worst players in the health insurance industry and in the healthcare industry in general, these big for-profit companies that are getting together and lobbying against real healthcare reform or revolution, whichever you want. Kind of want the revolution. So what we are seeing now is more and more candidates who are signing on. Probably our most famous signer to date is a young man named Zohran Mamdani. Hey. So more and more folks are signing on to the pledge. Graham signed on to the pledge in Maine a couple of weeks ago with the Nurses Union. And it's been really great. And again, we're building momentum. People are ready. Polling is great. People are jazzed. We've got some primary candidates. We are on our way.
I mean, I got a vision. You're giving people a vision for something better.
We are giving them the vision. That is absolutely right. That is, I wanted to end our news roundup on a very happy note. And then I'm going to turn it over to an interview that I recorded earlier this week with our very good friends, Alex Lawson and Eagan Kemp. Talking a little bit about the war and what that means in terms of the money that we have for healthcare spending and why we can't have nice things. So this episode is an emotional roller coaster. We've got bad news, good news, and the terrible morass that is the military industrial complex. So thank you so much again, Missy,
Thank you so much for tolerating me.
For tolerating me. Oh, Missy, I love you. It's so good to have you here, and I appreciate you filling in for Ben. Ben, we'll see you next time. And so enjoy this interview with Eagan. Hey, I am here right now with two of my favorite gentlemen. I'm sure you're both offended to be called gentlemen. I am here with Alex Lawson. Alex is the Executive Director of Social Security Works, the convening member of the Strengthening Social Security Coalition, which is a coalition made up of over 340 national and state organizations and represents over 50 million Americans. That's pretty impressive. How are you, Alex Lawson?
Very good. Just coming off of a really successful protest, which always puts me in a good mood.
Awesome. For those who are listening and not watching along, Alex is literally sitting in the car outside of a hospital where he has been protesting hospital closure. So we'll hear more about that later. But thank you, Alex. You're fighting the good fight. We love that. And we also have Eagan Kemp. Eagan Kemp is one of our favorite smart guys. He is an expert in healthcare policy, and I'm going to read off every single thing he's an expert in according to this public citizen website. Single payer systems, private health insurance, Medicare, Medicaid, the Children's Health Insurance Program, the Veterans Health Administration, the U.S. Food and Drug Administration, social determinants of health, mental health and drug shortages. Oh, and that's all, I guess.
Thanks, Terry. Always glad to be back on the podcast.
We love having you here. He served as the senior policy analyst in the U.S. Government Accountability Office. But right now, he is, because there is no more accountability in government, he is the health policy advocate for Public Citizens Congress Watch Division. Welcome, welcome, welcome. Love to have you guys here. So the reason we wanted to talk a little bit with y'all today is that, we're in the middle of a war. And wars always make me think of money, right? I mean, obviously, we're in the middle of a war with Iran right now. The president just today has doubled down and said no more Mr. Nice Guy. He said that several times, though, so I don't know when the nice guy came back. War is obviously egregious. As people who value life, we hate it. It is also a problem, though, because it costs so fucking much money that could actually be spent on saving lives. So after a year of hearing that we need to make massive cuts to Medicaid and other public health care stuff and, cuts to research and all this stuff, right? We're at war in the Middle East again. We're racking up unnecessary deaths and we're racking up a huge tab. Linda Bilmes at the Kennedy School has said that she thinks the cost of the war, she said, would definitely reach $1 trillion, even if it ended tomorrow. And she said that several weeks ago. Who knows where we are now? So we've got Eagan and Alex here today to talk a little bit about policy and why the U.S. is spending money on missiles but can't afford Medicare for all. And so my first question is this: why are we at war? That's a genuine question. I actually am not really sure right now why we are at war. Never mind.
I could take that one if you want.
Why don't you go right ahead? Yeah. Why don't you go right ahead?
It's. I think if you, in the great philosopher Black Sabbath,
Sure.
it's the war pigs and generals gathered in their masses. But the war pigs really are the billionaires. Because I think I sort of reframe a little bit your question, because wars cost money, sure, in one way, but also wars make billionaires billionaires. I mean, it is making an enormous amount of money. And also, like, Medicare for all costs money, but it doesn't cost money. It saves money, right? What costs money is the current healthcare system, and it costs the American people our money and our lives, right? And our health, and so often our dignity, and our peace of mind, so much. I mean, this hospital that I'm at is just one of hundreds of hospitals around the country that are facing enormous pressures, and they're going to close services, and you're like, oh, well, maybe my hospital is not on there. And he's like, no, man, we're all on there. Every one of us, unless you're a billionaire, you're getting screwed by the billionaires, and they profit off of war. They profit off of a healthcare system that doesn't deliver healthcare, right? They profit off of destruction and misery and things not working. Chaos is how they make their living. So wars cost money, but they make money for the billionaires. Medicare for all costs money, but it actually saves money for the people, and it costs money for the billionaires, right? You see what I'm saying? The problem is billionaires, war pigs, people who are willing to profit off of harm, death, and destruction. And that's who they are. So why are we at war again? Billionaires, greed. Why don't we have healthcare? It has nothing to do with cost. Again, I mean, in a very perverse way, you could pay for wars by giving American people healthcare, right? So it's not actually, they're not related. It's just a choice. We always have money for war because it makes the billionaires richer, and we never have money for healthcare for the people because it makes the billionaires richer to not have healthcare for the people. The underlying problem is the same: billionaires.
Yeah, absolutely. I mean, that sounds, that tracks with my experience of American life. So, and American healthcare, et cetera. Yeah, no, I mean, I think that that's a really good point, right? These are both cash grabs for people. There's a great quote from a lovely Cary Grant movie called Operation Petticoat that everyone should watch now. It's totally irrelevant to this, but they talk about, they're talking about war, and one of the guys says, in confusion, there is profit, right? And I think about that whenever we're in moments like these, right? So it's not just the fact that, you know, this chaos that they cause in the for-profit healthcare system, the chaos that they cause through this war, all of that helps to, you know, disorient us and get us pointing in the wrong directions, thinking this is a cost problem when it's really a profit problem, right? And so I think that that's really, that's very insightful. Yeah.
And I think the confusion and distraction is also an important part of this war, that they are trying to distract away from the affordability crisis that they've created, whether it's healthcare, whether it's food, whether it's gas, that they've created absolute chaos, and then have made it worse through this war, made a lot of the things even more expensive, difficult for people to get almost any product at this point at any reasonable price. And, you know, and obviously they're distracting away from all sorts of political scandals sort of across this administration and this failed administration. And, you know, I think we see a similar thing in healthcare, where it's always, you know, the Trump administration trying to claim credit for things that they don't deserve credit on, whether it's misleading the American people on things like prescription drug prices, where they haven't done anything to lower the drug prices. It was really Democrats passing legislation that allowed Medicare to negotiate for the first time, and now Democrats pushing for further legislation to make it even easier for Americans to afford their health care, whether it's Medicare for all, whether it's prescription drugs. And at the same time, Republicans are just trying to distract that what they did was cut health care to give tax cuts to billionaires at a time where our health care is only going to get more expensive. And as Alex talked about, hospitals are only going to close as a result, and they're going to get worse.
I mean, really, that's the context for it that always interests me, right? Because, you know, a budget is really a set of priorities, right? I'm gonna pay my heating bill, and I'm going to pay for a movie out, and that means that I don't get to have dinner out 5 times a week, right? Whatever. So, I mean, you know, national budgets are the same way, right? Like, I'm going to have a war in Iran, and I'm not going to have healthcare, and you know, whatever. So I guess the thing that we've been hearing all year, right, is that we don't have any money. The money doesn't exist, right? The money is gone. We have no money for healthcare. In fact, we need to cut healthcare, right? So that's the context that I'm thinking about this war. It's that, you know, there's been, all of a sudden, the money is suddenly there, right? When we want to fight a war. But do you want to kind of like set the scene, Eagan? Public Citizen did this amazing report on hospital closures specifically as one of the indicators of the kind of negative consequences that are coming out of Republican policies on healthcare. Of course, not saying that healthcare was great before, because it fucking blew already. It just somehow blows more now.
Yeah. I mean, the amount that we spend in any given year could fund excellent healthcare for every American. And instead we get terrible healthcare for tens of millions of Americans and decent healthcare for the wealthiest. Not even the best healthcare in the world, just decent. I mean, we spend over $5.3 trillion a year as of 2024, over 15,000 per person. That's more than double any other comparably wealthy country. And those folks guarantee healthcare for everyone. So we have a ridiculous amount of money. We could obviously afford a much better system that would actually serve people. And then we have these cuts, and RFK Jr. was recently in hearings where he said no Medicaid cuts, which was just a lie. And these folks are willing to lie about all of this not even Republicans were buying his lies in those hearings. You had Republicans talking about hospitals in their districts that were struggling and asking tough questions. And the fact that lies are getting so bad coming out of this administration that even Republicans in Congress have found their backbones at times is shocking. The report that you talked about, we found that as a result of these nearly $1 trillion in Medicaid cuts, almost 450 hospitals are going to be at risk. And that means, a big employer in a lot of these communities. They serve millions of people in their catchment areas. And now if they either cut back services, and we're hearing things about, labor and delivery in a lot of hospitals cutting back, but now a pregnant woman is going to have to drive even farther or not be able to have easy transportation to give birth.
And we already have some of the worst maternal mortality rates in this, developed world. Yeah, absolutely.
Yeah, that's only going to contribute to this. And it's going to threaten the access to care for far too many Americans at a time when, that money just went to billionaires and mega millionaires so that they could be happier about these taxes so they could give more money to Republicans in the Trump administration and whoever ends up running for president among Republicans. And they're just buying off their donors. And we know that that's the case. And, we see how RX companies are giving money to Republicans and insurers and the for-profit hospitals, where it's really the mom and pop hospitals, the ones that are trying to make it month to month, not the ones with these billion-dollar war chests that can all of a sudden buy off politicians. And so it's really scary. I mean, I no matter where you live, there was hospitals in every state. There was hospitals in all the Republican districts that voted for this bill. That folks on the Hill aren't looking out for their constituents. They're really putting them at danger with votes like these.
Absolutely. And Alex, the hospital that you're sitting out in front of right now, where I assume security is eventually going to escort you off the property, as they frequently do when you get involved.
We're across the street at this church, and we were on the sidewalk. But yeah, they're not going to escort me anywhere.
But the hospital that you're outside of is a hospital that also where folks are worried about closures. Yeah.
Yeah, so I'm in Mike Lawler's district, who's just a real piece of shit. And he's got a super...
Don't sugarcoat it, Alex.
He's a super hateable face, too. If you haven't Googled him, you're like, what are you trying to hide with that beard face, man? And it's evil. This guy voted to cut, $1 trillion from Medicare. It's all of the things that we know they've done. It's the largest destruction of healthcare outside of wars, right? So the only societies that have faced the contraction of this level in healthcare is when you have a war, right? Outside of that, no one has been like, you know what we should do? We should just kill an enormous number of our people by ripping healthcare away from them so that we can give trillions of dollars in tax handouts to these billionaires. And another thing that Eagan, it wasn't on the list of things that they're distracting from, but I think we all know those billionaires are the ones who they take their golden yachts that they buy golden yachts with the tax cuts that come from our healthcare, from killing and harming the least of us, to give billions of dollars, trillions of dollars to the worst of us so they can buy a yacht to go to fucking Epstein's Island and commit unspeakable acts of evil. It's not, that's reality. It's fucking bad that they're like, you know what would be better than facing this reality? War. We'll just war is actually like, they're like, yeah, that's better. We'll do that one. And then we won't talk about the fact that the president is most likely a child rapist, right? Like, we're not going to talk about the billionaires who are getting this money that comes from people dying. Yale Public Health says 56,000 people per year will die going forward, premature deaths due to the cuts that Mike Lawler voted for. Right. So like, I'm not going to sugarcoat it. I usually sugarcoat it. But in this one, Jillian, I get to not sugarcoat it. But also it's real policy, like it's health policy. People don't understand the magnitude of harm and shit that is flowing at us in this district, one congressional district. There's 2 hospitals that are at enormously high risk of closing. And that's policy speak for they're going to fucking close. Hospitals are going to close. And you know what happens? The people who went to those hospitals, they go to the hospitals that aren't going to close, right? But those hospitals that aren't going to close are now packed with more people. And it's called uncompensated care because our stupid fucking system is about making money, not providing health care. So we're like, they're not profitable. So what happens is the ones that don't close are like, dude, we better cut back on the services that aren't profitable. And you're like, what are those? And they're like, oh, it's the ones that you mainly think of as hospitals, right? Oh, it's where you go to deliver a child. It's level 1 trauma centers. And they're like, the things that people need in healthcare are not the things that make them money. So if your hospital's not closing, it's going to get way worse. Your standard of care is going down. And we have garbage standards of care before this. Highest cost healthcare in the advanced world with the lowest outcomes. We have the worst healthcare that's most expensive. So the one thing, just so to close on, is we don't have, it's not like a kitchen table budget. The U.S. budget is not like a kitchen table budget. It's bullshit on all sides that we can't afford. It's not about affording. We are the richest country in the history of the world. The richest country in the history of the world. But you know who believes that? Almost no one. Because they don't see it. They don't feel it. They're like, how can we be the richest country in the world if I have to go deeply in debt to get an education, or I have to see 90-year-olds picking up a job at Walmart because they need it to survive, and then the local news picks it up as a heartwarming story, and you're like, what the fuck is wrong with this? It's not that we can't afford, it's that the politicians have made choices, and they're evil choices to hurt the least of us, to help the worst of us. So once the American people really, really wake up, and man, they are awake now. I'll tell you, just, you pick up a megaphone, stand across from a hospital that's at risk, and you're going to have a crowd of dozens of people join you in no time at all. Because people are pissed.
Sorry, that's the reality. I mean, that's and even before these cuts, the polling shows that Americans are more fed up with the healthcare system than they've ever been. Only 16% thought that the amount that we spent on the total cost of healthcare was reasonable. 70%, including majorities across the political spectrum, said that healthcare was in crisis or had major problems. Poll after poll after poll is showing that the healthcare system isn't working for the American people. And we know that the only people that it's working for are the ones that, as Alex said, profit off of the system. And it's why the fight for Medicare for all is as big as it is right now, that you're getting more and more groups, more and
Yes.
more everyday Americans really engaging. You're getting more members of Congress in both the House and the Senate signing on, because they see that this is the future of healthcare. It's the only policy that's out there that actually gets us where we need to go, brings down the overall cost of care, and really addresses all of these nightmarish dystopian hellscape things that Americans are experiencing every day as they try to get the healthcare that they need and deserve.
Absolutely. And people are just, people are tired of Band-Aids, right? People are tired of, let me propose something that's going to help people from ages 5 to 17, or let me help someone, make a proposal that's going to help people who are in one very specific situation where they can opt, whatever. It's like, fuck that. No, people actually want healthcare that's going to cover everyone. They want healthcare that's going to cover the things they actually need to. So
yeah, it's an important solidarity policy. I mean, when you look across the country, universal healthcare, their experience of healthcare politics is vastly different than ours. Whereas we're bifurcated and fragmented in so many different ways, folks trying to get whatever they can through whatever combination of programs and healthcare systems and state versus federal. It's just so confusing and so challenging for people to get what they need. Whereas across these other systems, there's a real solidarity that conservatives in those systems would never even think of trying to move to our system. And even where they've taken, dipped their toe in the water, there's been a huge backlash in those countries. People get thrown out of office, and they get put in by people that then are working to shore up their healthcare system, make sure that people are getting the care that they need, and those their problems we would wish to have. That any concern, there's no health system that's ever going to be perfect, but I don't think Americans understand just how bad our system is compared to other systems. And I didn't understand it until I lived in Canada for a couple of years and was just like, this doesn't have to be so hard. This doesn't have to be so terrifying. Every life decision I make doesn't have to have as its bottom line question, how am I going to get healthcare? You could actually just live the life that you want to, and healthcare is just there for you when you need it, which is how it should be.
Well, that sounds like a happy dream to me.
A happy dream that every other peer nation, every other advanced economy in the world has somehow magically been able to figure out, right? That's what I think is becoming more and more apparent. And the propaganda that the American people are under, I never sort of, Michael Brooks, late Michael Brooks, great thinker, he would say, sympathy for the conned, none for the conmen. And so you do have to understand that people are told, no, you love your insurance. No, we have the best healthcare in the world. And it's just inundated. But that's starting to break because it's so apparent to anyone who touches the system or has family or friends who touch the system how bad our healthcare is. And that every other country, it's like, oh, you get sick, you get the care that you need. There you go. And you're like, that is not what happens here, man. Like, you guys don't have deductibles? And they're like, I don't even know what that is. And you're like, what do you mean? You don't have co-insurance? And like, again, I don't know the words that you're saying. What about prior authorizations? And they're like, I think those are all made up words. And the truth is, they're made up concepts in health insurance, right? Like it's all, and they come, right? Prior authorizations are like a new one. They're like, oh, what about we're gonna do narrow networks, right? All of these things are just the same thing with different names on them. It's not profitable to give healthcare. It's wildly profitable to restrict healthcare. When you make health a scarce commodity, you can make enormous amounts of money, unimaginable amounts of money. The only downside is that it's based on killing people, right? So you have to be an evil person. You have to be a sociopath or a psychopath who doesn't actually care that the enormous amount of money that you can make by making healthcare scarce leads to death. That's just the reality of what we're talking about. There's no reason for it. We have all the resources that we need. The one thing is that the system, sorry, this is such a wonk digression, but I had to.
We'll cut it out
Our
later.
system is so bad that we are going to be facing pretty soon really real, like we won't have enough primary care docs. We're not going to have enough healthcare workers to actually provide for our people. Not because like we couldn't afford it. It's because we've ground them down so much or driven them into these specialties that we are going to face these incredible potential bottlenecks and shortages. But besides that, there's nothing that we can't afford. Again, it is macroly, massively profitable for the United States of America to give good health to people. Like, for example, and I'll stop after this, but the VA, we paid for it, tax dollars. I'm going to do a couple different things. We paid for the development of GLP-1s. We were like, look at those fucking Gia monsters. How do they only eat one time a month? Scientists were like, we're going to dig into that. And they did. And they found this molecule and they're like, dude, this shit is amazing. And it is like really amazing. And it's amazing for so many people. And it really can help people live healthier lives. But then in all of our American wisdom, we're like, what if we took this thing that we paid to develop and we just gave it to a foreign pharmaceutical corporation who then turns around and charges us the highest prices in the world? And, you know, politicians and the pharma execs like high five each other. And then they're like, oh, we can't afford this. Of course we can afford it. We can't afford the choices that were made there. The molecule costs pennies. And if we were to provide it to people based on public health, the greatest benefit for those who need it, right? The most benefit for those who need it the most. That would save our system money. You have the cost of diabetic amputations, hospitalizations, blindness. The most costly things in our system are actually generally symptoms of our catastrophically like extractive healthcare system, right? People delay care. It's also they sorry, my computer just, am I still here?
You're good. You're good. We got you.
So people delay care, and then because they're worried about how much things cost. They don't they don't invest in preventative care. That's what costs money. That's what costs money to the state, to us, the taxpayers. We could absolutely fund like golden highways for everybody if we just got our priorities straight. Instead of golden yachts for billionaires, we could build a society that is the pinnacle. The richest country in the world could provide the best healthcare to everyone, the best education to everyone. We could work together to solve problems for everyone instead of profiting off of making problems for everyone.
I mean, I love that. I love that. I think that's absolutely right. It strikes me a lot that like a lot of what we're talking about here is like kind of, I mean, I guess you could call them lies. You could call them kind of cognitive dissonance, if we want to be charitable, right? But like these things that people convince themselves. So, you're right. Absolutely. That there is money, right? The system isn't, broken. It's fixed, like the money is there, we're not broke, et cetera, et cetera. So yeah. And even I slip into it though, right? Like even I know this, and I slip into this kind of scarcity thinking. Another area where we have this kind of false consciousness, I think, is around this issue of security, right? And one of the things that is just coming out to me as you guys are talking is, so one of the reasons that Trump gave for us going to war in Iran he gave several, and I still don't know which one is which right now. But one of the reasons he gave is national security, right? This idea that Iran is like a threat to our national security. But when you talk about the kind of healthcare cuts that are happening right now and the kind of just dire situation that people are in, when I think about the people around me in South Texas, we already have no providers. We have to drive 4 hours to get to a doctor. I have a mental health provider. I finally got a mental health provider in town, but I had one in Houston for several years. So when I think about all that, I think about the fact that bad healthcare policy, may be a worse security risk to the United States than Iran. And I kind of just wanted to see if you guys were on the same page with me there. Can you make the case that healthcare itself is actually a national security issue?
Yeah, I think we only have to look at the COVID-19 crisis. The COVID-19 crisis was a perfect example of just how our healthcare system put millions of Americans at risk unnecessarily, whereas other countries were sort of ready to jump into action. Countries that had universal healthcare systems had many fewer deaths, and it was for two reasons. One, because they can quickly turn that healthcare system towards the crisis. Our healthcare system has so many fragmented pieces that all of them need to figure out how they're going to make profit off of the COVID-19 crisis, not how they're going to serve the American people. And because Americans are sicker. This is the one thing that RFK was right about, but he was right about it in the wrong reasons in recent hearings. He was talking about Americans being sicker, having worse chronic conditions, but that's because of our healthcare system. Sure, there is a nexus with food, but one of the reasons Americans eat worse food is because of our food policy as well. Because again, it's at bottom line by billionaires consolidating and making sure that they're getting their cut in every bill, every farm bill, every nutrition bill, making sure that they're profiting while Americans are facing food deserts and eating worse food. But we also have such poor health, whether it's chronic condition or infectious disease, because our healthcare system isn't approachable. That if you had people being diagnosed with their chronic conditions throughout their lives and having regular access to treatment, we wouldn't be in the same situation. When you can look at when people turn 65, they get on Medicare. Many of them have multiple chronic conditions, have significant diseases that they put off treating because they haven't been able to afford it. Where if you look at the similar statistics in other countries, they're treated sort of throughout their lives. They're always on healthcare. They always have access to their medicines, so that these conditions aren't, somebody turning 65 and being like, I knew I had a lump in my stomach, but I couldn't go to the doctor because I knew it would bankrupt me. And now it's stage 4 cancer. Whereas if they had immediately when they felt that lump and it was stage 1 or 2, it would have been much more treatable, and that person would have likely lived. Whereas now they're still facing huge healthcare costs. It might not bankrupt them because they are on a Medicare, as long as they're not on Medicare Advantage, which is going to put them in a terrible position. And that's just the reality. And I can understand, Alex, as you pointed out, and Jillian, as you mentioned, the disinformation that Americans experience. I can understand why something like the Make America Healthy Again movement appeals to them, because we've been told it's what you do as an individual, not what we do as a society that determines your health. And that's just wrong, and that serves the profit centers. But we hear it so much as Americans that you only think, well, I can't influence the government. I can only do what I can do individually. And so these hucksters in Maha that are just trying to make more money off of supplements or other BS things are just raking it in, and having somebody like RFK Jr. at the head of HHS only makes it easier for them to not only confuse Americans but make money off of them.
It's true. Plus, he almost got Cheryl Hines killed, by not helping her off the stage. All right. So, guys, I really appreciate talking to you. You get me energized. I hope that you've also gotten our audience energized to get out. And
we love talking to you. And I love talking with Eagan because I was like, that's what I wanted to say. What he was saying, I associate myself with those remarks. I just would swear more, but otherwise, this is the smart guy here. I want to do one more, Jillian, before I just toss it back to you, because everything Eagan said is really good and right, completely correct. and none of us are going to imitate RFK's voice because it's so ridiculous that no one can even pull it off. You can do it.
Pretty good.
But I'm interested. Garble bullshit. There's mine. The one thing like that's bigger is about the COVID-19 and this. I'm a public health guy. That's where I come from. And I got my master's, and my capstone was on pandemics. So COVID-19 changed the world, right? And COVID-19 killed so many people. All of the destruction that came from it, just devastating. COVID-19 is one of the smaller ones. Actually, it's one that in the public health world, you're kind of like, oh, thank God it wasn't H1N5, H1N1, right? Or foaming monkey fever. If you want to read the Journal of Emerging Infectious Diseases, you'll actually learn quite quickly that pandemics are species-ending events. And what we are in right now is an era of ever-increasing risk of species ending. And just to be clear, humans are the species who would be ended, right?
Yeah.
This happens. We're like, oh no, we're special. No, this can absolutely happen. You got chickens and pigs in the same area, and you're doing factory farming, and it's mixing up. Like, you're gonna create something that can kill everybody.
Yes. And
amazingly, we're so lucky. The only thing that humans are more than stupid often is lucky. You're just like, oh. But some of it is that we're lucky that we have brilliant scientists who are publicly funded and created mRNA vaccines, which are a miraculous step up in technology and were the reason why COVID-19 wasn't double, triple, quadruple as bad as it was, as terrible as it was, because we had already developed this technology. Taxpayer funded. We paid for it. Then you know what we did? Gave it to a private company.
Yes.
Who then again created scarcity on something that is not a market product. And if we had a rational public health system based on public health, we would be developing these vaccines in preparation for the very real national security risk, global security risk that actually pandemics are, that infectious diseases are. And we, instead of doing that, Garble Voice is literally out there attacking the miraculous thing that was created with taxpayer dollars. But then we give it into the corporate profiteering machine. And again, what they do is create scarcity. How can we make money off of a pandemic? And you're like, guys, it could kill everybody. Don't try to make money off of it. Prevent it from happening. That's how you make money off of it, right? Yep. Like eliminating smallpox is how you made money off of it. That's the kind of thing we can do when you are in a system that's focused on public health and not private profit. So it's like we need Medicare for all. We need Americans to have the same access to health care that people around the world do. But also we should remember that in taking that step of re-engineering our system to a healthcare system, we could actually go much further. We could become a society that is looking and can provide the best for the most and not the most for the worst. The best for the most is healthcare for everybody, and the most for the worst is trillions of dollars in to a handful of billionaires to get golden yachts to sail to Epstein's Island. Like, when you really think about it, what are we fucking doing? And all we have to do is stand up together and raise our voices, and we'll win.
That's right. Because the one amazing thing about the healthcare system and about our fucking billionaire, driven political system in general is that there are many fewer of them than they are of the people who are getting fucked by this, right? Absolutely. So I think that you have ended it with a really good binary. It's Epstein Island or Medicare for all, right? These are the two choices. By the way, Eagan, I just want to say Eagan didn't say that out loud at all. He's a more diplomatic person. But I'm with you, Alex. Yeah. So I really appreciate this, guys. Oh, by the way, we were talking about the vaccine. Shout out to all my friends at the Free the Vaccine campaign and the Society for Creative Activism. That was an amazing experience during the pandemic. They did really great work fighting to get the vaccine out there, both in the U.S. and to developing countries. But yeah, we can't give up now. We got to move towards Medicare for all. And yeah, fuck the billionaires. Yeah.
Yeah, exactly.
Yeah. All right. Well, thank you so much, guys. Thank you to our podcast team. Thank you to Ben Day, who unfortunately couldn't be here today, but we'll be talking soon. And thank you to our audio editor, Craig Stanton, who is amazing. Remember to like, subscribe, comment, and share with your friends. This podcast is a project of the Healthcare Now Education Fund, and you can support the pod by going to www.healthcare-now.org and clicking on the donate tab to send us some love. Thank you so much, everybody. Stay safe and stay dangerous.